Well, it's a fantastic addition. We all know that so many families are struggling from so many different situations in their lives and crises, and cancer is a big part of that. And if we can make their lives so much simpler and easier to have the treatments, and I think that's really the essence of this, along with new technology, but allowing the families to participate and be comfortable when their family member is going through such a hellacious situation in their lives, and comfort and being settled and making sure that people get the right feeling and supportive of their family member, along with the new technology that's coming online. I think that is just a prescription for greatness, and it's just a lot like what Community Health Network does around the state is be a rock, be a safe harbor, and support their community in so many different areas.
This means that we're going to have new ways of fighting cancer, new technology, and we're building intellectual capital that will benefit the people that live here, the people that will be patients and workers, but also it will help fight cancer in the future. You know, one of the themes of today is firstly about patients and serving patients and their families, but secondly, how we can fight cancer and cancer no more, and that's everybody's goal. And this is a significant step toward that for Central Indiana, the economic driver of our state.
I think the main thing as a patient and having had personal experience with my family, when you come to a facility, you want to know you're coming to one place and that people are coming to you. As a patient, you're already scared. You have so many things going on, and to be made to go 3 or 4 different places to get an x-ray or see a specialist or set up a surgery, it's a lot to go through, and families go through that with you. But this facility is basically you come in and we're here to help you. You will see the physician there, you will have your x-ray there, you will get scheduled there, you may have your Tai Chi or your yoga, whatever you need, the facility is there to help you, and that's what this is about, helping the patient. It's actually going to be much easier. So right now, if I order a test, I have to follow up that it went somewhere else, or that it went to an outside facility, or did they go see that specialist? When is their appointment? You don't have to worry about that. It's centralized. You come in, you can look at a book, or I can talk to a physician who's 2 doors down or 1 level down. It makes cohesiveness better, communication better, and if doctors are working easier together, patients are going to get a better outcome. You know, MD Anderson, once again this year, is #1 in the nation. We have used their resources, their expertise, their guidance to help us expand our program to one now that we can rival anybody in the Midwest. We have great physicians. We just needed something with an infrastructure improvement, and that's what they've given us. From pharmacy to oncology, we get opinions from them. We are doing all the right things. We just needed their guidance to make sure we could take over this area in the best way possible.
We've really been cramped in the existing facilities that we have. We see a large number of patients, and what that's limited us in is being able to provide directly in that cancer center some of the ancillary services and a lot of the supportive services that are critical as patients are going through cancer care. So because of that, we haven't been able to provide the type of environment for treatments that we want to. We haven't been able to provide a direct area in that same facility for physical therapy, dietitians are squeezed in there, speech therapy squeezed in there, all these other services. And so this facility has been designed to allow us to provide all that and really provide a comprehensive cancer program to each patient. There's really 2 different aspects. One is integrative medicine, which a lot of people use as a term somewhat synonymous with alternative medicines, which include art therapy, massage therapy, sometimes acupuncture, Tai Chi, yoga, those sort of things. But then there are the more standard supportive services like dietary and physical therapy and genetic counselors and our breast navigation program. And so there's all of these support services, financial services, social work, all those that will also be included, and that's all included within this building. Right now, because of the physical limitations, patients have to go to multiple different areas to get that care. And now, as they come to the cancer center, we can provide all that together. And even the physician services, a lot of it is split among different offices and different parts of the campus, in different parts of the Community North campus. And now we're going to have all that under one roof.
This cancer center will have some wonderful new amenities that we have the luxury of adding because we have space. We have had input from patients, caregivers, family members, and what this affords us that we don't have currently is the ability to have space for families while patients are undergoing treatments. There's normally a family involved in the battle of cancer along with that patient. And we will have great support space for that. More importantly, there are just so many things that have been built into this new cancer center. From the entry, when someone enters it for the first time, it is designed to decrease anxiety. There are gardens, there's lots of use of natural light. There is a labyrinth that will allow patients and family members to take little walks and meditate. There is going to be music throughout the facility, and there are coffee shops and lounge areas. In addition to, in the patient suites, there will be smart TVs and computers that will really allow the patients and family access to the world outside of the cancer center while they're visiting us. We consulted with our Office of Patient Experience and had them lead some focus groups for us with our patients. And patients truly thought of things that we as caregivers did not think of. Nurses and pharmacists and physicians think very clinically. Patients thought of things that, such as, example would be, can you put exercise equipment in some of the rooms? We had a patient who loves to exercise and was very frustrated when she'd come for chemo and have to sit for a few hours. And her request was, have a stationary bike for me so I can ride as I'm trying to beat cancer. So there are items like that that have been built into the cancer center that have come because patients told us this is what we need. This building will be a 3-story facility and it will be a total of 104,000 square feet. Across the floors there will be radiation oncology, there will be medical oncology that will include the chemotherapy infusion rooms, and there will be surgical oncologist offices. It will also include other treatments that are not available in the building today. For example, there will be physical therapy services for patients who need those services.
It is outstanding in a single word, and I will tell you that I believe the reason why that it is because Community Health Network is focused on its patients, and because it meets and exceeds all of the criteria that is literally required to be a good partner with MD Anderson and for MD Anderson to partner well with an affiliate. Community Health Network has really become the gold standard in terms of what this means in collaborating with Anderson and really sharing what it is that they're learning from Anderson with its community of physicians and patients, and then really creating an area where Anderson can test its concepts around what membership is, what affiliation is, and what it means to be able to share all that has been developed at Anderson with our partners. In 2 words, it's rigorous, it's deliberate. What the affiliates go through, what Community Health Network has gone through not only in its flagship hospitals, but also in the other hospitals across its system, is deliberate because they are looking for quality standards that not very many hospitals can meet. It is requiring physicians to actually make a commitment to adopting MD Anderson standards. And then it requires the entire organization to collaborate around the single patient, around the concept of highest quality in order to make the guidelines work and to know that MD Anderson is going to be supporting these organizations as they go through this journey.
I think it means a great deal for our program. There's no question about it. We are very appreciative to have an opportunity to build a new cancer center on the North Campus. This will be, to some extent, a flagship for us. It's over 100,000 square feet. It will have 3 floors, and it will provide care not just for acute oncology care, but it will treat the entire patient. I think turning the tide in terms of cancer treatment for patients means something different than it did several years ago. In the last 40 years, we've managed to improve significantly the morbidity and the mortality ratios of our cancer patients. So not only are we diagnosing more cancer than ever before, largely because of the baby boomer population, but we're also having to realize that we are living with more patients with cancer than ever before. So those patients have ongoing monitoring. It's about health and wellness. It's about diet. It's about how do we make sure we reduce the recurrence rates as much as possible. So we will treat your cancer on diagnosis, but we will also treat you throughout the life of your cancer. The volume of cancer patients is growing within not only Community Health Network, but nationwide. And that, again, is part of the baby boomer population. The smoking rates that we used to see previously, we are beginning to see a lot of that population now with lung cancer. So none of this is a significant surprise, but certainly in terms of Community Health Network's population of patients, this is part of the fight. We are making sure that we have both the physical plant in terms of the facilities to treat the patients, as well as the expertise to treat the entire care continuum of those patients. There is a significant need, just based on the volume of cancer that we're seeing nowadays, which is, again, expected with that population of patients. Cancer is no longer the death sentence that it often used to be associated with. We can beat cancer, but we have to catch it early, Linda. That is the key. And too often patients have fear, or they don't get the annual mammogram, or they don't get the annual, or get the lung cancer screening, which is available to them. And I would encourage them to do so, because that can be the difference in not only diagnosis, but successful treatment and living with cancer successfully. The connectivity of the hospital is very important, and we're very excited about that. There's no question about it. It will allow us the opportunity to very easily treat patients who are inpatients. So if they come in and they are initially diagnosed, or they have an ongoing illness, without having to put them on an ambulance or for them to have to wait until they are ambulatory, we can just wheel those patients over and treat them during their, while the disease is affecting them in a very acute manner. So it allows us to treat patients throughout, again, the entire care continuum. Well, for one reason, the cancer patient is unique because I think they face the scariest 3 words that anyone could face in any language. You have cancer. And so they are the bravest people that I've personally ever met. And the uniqueness of this cancer facility, I think, incorporates all of the current modern day thinking with regard to treating cancer patients. Not only from an acute care standpoint, does it also consider research and health and wellness and things of that nature, but it takes it to the next level. And I think Dr. Way said this very well, is that we did not only consider the cancer patients of today, but what is the modern day thinking of tomorrow, to the extent that that's possible.